Good afternoon, good evening, everyone. My name is David Rodriguez. I am the Director of Education for Biolase and the host of this evening's webinar featuring Angie Wallace. I'm very glad that you were able to join. I am looking at a group chat. I'm also looking at participants, and I understand people are just logging in now, so perhaps we'll give them just a couple more seconds, and I'll begin the webinar by introducing tonight's speaker, Angie, and framing the webinar, including some time we have put aside for Q&A towards the end of the program. We're very excited that you took some time to join us, and we'll start in just a moment. Okay, to be respectful of everyone's time, we'll get started. The title for tonight's webinar is Integration of Laser Dentistry Through Hygiene, featuring Angie Wallace, a registered dental hygienist who's joining us this evening from Oklahoma. Angie is a very well-regarded speaker and friend to hygiene at large. She's been a clinical hygienist for over 30 years. She's a member of the Academy of Laser Dentistry, where she obtained her advanced level proficiency, her educator status, and her recognized course provider all the way back in 2007. She also maintains her mastership with ALD from 2008 on, and she is currently serving as co-chair for regulatory affairs for the ALD Board of Directors. She also serves on many auxiliary and education committees. She was the recipient of the 2014 Distinguished Service Award from ALD and has been recognized worldwide as a speaker, in-office laser consultant, and author on all things hygiene and lasers in hygiene. We're very grateful to have Angie joining us this evening. And with that, I'll turn it over to her to have us join the presentation in progress. Angie?
Thank you so much, David. I appreciate your introduction. Welcome, everyone. I'm very excited to have you all here this evening. We're really excited to let you see some of the Biolase things that we have in store for you, and we'll go ahead and move forward with all of our presentation this evening. When we start wrapping up, David will come back on and he will actually see if there's any questions and answers that we can spend the last few minutes of our call doing that. So without further ado, we'll go ahead and get started. So this is what we're here for. This is our new Epic Hygiene. We are so excited to let you see this if you haven't seen this before. So it's got all kinds of designs that were put together by several hygienists. So our little claim of design by hygienists for hygienists really comes true in the fact that we spent many hours finding and listening all the tips and suggestions that so many people wanted on a laser to make this the best laser for hygienists. There's my disclosure, just a little bit about who I am and what I am as far as producing lasers, working with them, and the products that I use, and working in clinical hygiene. This is why I do what I do. This is my family. So blended family, but we have a great time all together. And as you can see, several people have a hard time even deciding which kids are mine and which ones are not. So I claim them all. So we're going to start a little bit with fundamentals of lasers. I don't want to spend a lot of time on this, but I know there's some people here that have attended recent meetings that maybe have no idea what lasers can do. So I just want to kind of touch on that a little bit before we get more into what the Epic Hygiene laser can do. So light, as you know it, is made up of very small particles called photons. And these photons move in waves, which allows us to be able to see them. So our rainbow of colors come into place in this particular light. With those ordinary lights, they have multiple wavelengths that are very non-directional and very non-focused. So they go anywhere they want, just like the sunlight does. Laser, you may know as an acronym, but what it really stands for is light amplification by the stimulated emission of radiation. So there again, laser is an acronym for this. Laser light, on the other hand, is completely different. It's typically one color, which is invisible. We cannot see our laser energy because it's outside of that visible spectrum. And so that typical color that we do see is either red, or for some lasers, blue or green. So the red color is a thermal energy that still gives us some type of therapeutic benefits where we can actually use that low-level laser to get other benefits for it on the side. So red is a good color to be using for a laser. It's very highly focused, it's very directional, and very organized and very efficient as far as what it can do. On that region and boundary, our electromagnetic spectrum has different categories. The ultraviolet, which many of you are very familiar with by working in clinical hygiene, where it's going to be your x-rays and things like that. Our visible spectrum, which is the colors we see every day, and the infrared portion of the spectrum, which is going to be where the majority of our lasers fall into place. This has always been one of my favorite slides because this really shows us kind of what we're looking at. The invisible ionizing radiation on the far left side of your screen will show where those x-rays and ultraviolet picks up into place. Those shorter wavelengths can enter the nucleus. That's what makes those concerning and somewhat considered dangerous. However, on the other side, the right side of our screen, invisible thermal radiation is where the majority of our lasers fall into place, either in the near infrared, the mid infrared, or the far infrared. These longer wavelengths cannot enter the nucleus, and so therefore that's what makes lasers safe to use, is because it is light. So it's light energy that we're using as opposed to ionizing radiation. This is how all of our lasers fit into these categories. Now, we're not going to spend a lot of time on this, but I do want you to recognize that when we have the lasers listed in red, those are the soft tissue lasers. Our hard tissue lasers are listed in white, and we also have our CO2 lasers, soft tissue lasers, that are listed in green. The ones that we're going to primarily focus on tonight is going to be the EPIC X, which is our 940 diode, and we also have our EPIC Hygiene, which is categorized as a 980 diode laser. Our laser emission comes in several modes. We can either put our laser into a continuous wave, so that when our foot is on the foot pedal, it's always on. We can have chopped or gated, which means that it's 50% on, 50% off, so we can actually have it on and then let it pulse off. So think of it like hitting someone's shoulder. It's allowing that energy to relax so that we're not hitting that tissue constantly, but allowing thermal relaxation to occur. Super pulsed. And then we have free running pulsed, which is basically off with large bursts of energy that happen independently as they choose to do so. What we're going to refer to tonight is continuous wave and chopped or gated, since that's what our lasers operate in for the majority of its characteristics. Everybody always wants to know, what settings do we use our laser at? Now, the best part is Biolase and EPIC Hygiene and the EPIC X already have little settings that are listed in the laser, which are great suggestions of where to start when using a laser. But I really want to stress the point that that doesn't mean that those are the only settings that you will use and that you will never adjust or alter those, because of all these other things that come into place. When laser tissue interaction takes place, we have to take in all these things into consideration, but one of them that people tend to forget the most is tell me about your patient. The tissue characteristics or the pigmentation of their tissues will also make a big difference as far as how the laser is going to interact with that tissue. Meaning that if we have somebody with lighter skin tones, it may take more laser energy to do what we need to do. And if they have darker skin tones, we may have less laser energy that is necessary to allow the laser to interact. The reason for this is that diode lasers are attracted to dark pigmentation. So it's going to interact faster in those situations than the other way around. The way that these absorb, as we were just talking about, depends on what they're looking for. So if you look at this slide at the very bottom, there are all the different lasers. And we can tell that our diodes and our NdEggs and our argon lasers are attracted to melanin. Look, when we put in hemoglobin or blood, which lasers are attracted more to blood. If we add in hydroxyapatite or tooth structure, we can see that our erbiums and CO2s peak a lot higher. And if we add in the last thing being water, you can see that a diode that's an 810 has less attraction to water than a 980 diode does. So that's how you would read this and know what you're looking at with the tissue to make sure that we're getting the correct interaction with the correct laser. The other modes of use that we can use it is contact mode, meaning the tissue is touched by the tip of the laser. If this was a doctor, it could be creating a very narrow but deep incision. Of course, in hygiene, we're not going to be cutting tissue. That's outside of our scope of practice. So we would be interacting with the tissue at a low setting, which could decontaminate or eliminate or possibly reduce bacteria. A non-contact mode means that maybe we're using a laser that doesn't have a laser tip on it. Maybe it's a gas or some other ingredient that is going to allow the laser to work. Or in hygiene, if we're using a diode laser Non-contact mode could mean that we're working on a herpetic lesion and that we're purposely not touching the tissue. So we have different types of lasers. We talked about diodes in our categories. We have an 810, a 940, a 980, and a 1064. Those are all the different diode lasers on the market. As I said, Biolase is a 940 laser, and our new Epic Hygiene laser is operating at the 980. It also shows what their active medium is and what their attractions are, how we can use them, what they can be used for. So this is what we used to work with biolasers. On the far left, that was the first Biolase laser that I ever saw from Biolase. It was quite big, had lots of buttons on there, and is still very operational. I've seen them in clinical situations very recently. So once they're made, they last a really long time, which is great. So that's the one on the far left. Then the Biolase EasyLase, which several offices still use. Then we had the Epic iLase, which works great for doctors that are doing recontouring, maybe herpetic lesions, a simple procedure that isn't going to take a lot of time. So look how they've evolved, because then we had two of the best. We had our Biolase Epic X and our Biolase Epic Pro, which are our two still great lasers through Biolase that we still continue to use and sell every single day. Great resource of information. But then we decided we wanted to make the designed laser for hygienist by hygienist, and that's how the Epic Hygiene was introduced. So this is it. And as I said, we had so much fun going through and changing things up on this, even picking the color of the side of the laser, which was really a fun thing to do as well. So you'll notice a lot of different changes that have taken place from the Epic X using that same model and just designing it just for hygienists. So here's how the difference between the Epic X and the Epic Hygiene are coming into play. My biggest thing when I look through all this is the difference in price point. For instance, several doctors may choose the Epic X because of the average power and the peak power, when in hygiene, we do not need to use that much energy. The best part about that price point is that doctors could purchase two Epic Hygiene lasers for almost the same price that they're purchasing that Epic X, and that way their hygiene department has a couple lasers to where they don't have to share. The main reason for that is anytime somebody has to get up and go get something, as opposed to having it right close by them, that makes all the difference in the world if they're actually going to pick it up and use that laser. So for doctors to have one right there ready to go for their hygiene team, we're going to see them using it a lot more, having a lot of great results, and much more knowledge and understanding of how that laser works. This is from our handbook for our Epic Hygiene that shows you a little bit about what the Epic Hygiene can do. So these are all the modes of action, what the peak power is, what the average power is, the pulse length, the pulse interval, which duty cycle we're operating in, and which tip are we suggesting that is going to be best for those particular procedures. So as you can see, the main ones are going to be pocket therapy, periodebridement, curettage, which you will see that those are the same settings for 2 and 3. Just some people refer to it as curettage. We prefer to call it periodebridement. Then up to 4 preset is the aphthous ulcers and herpetic lesion. There again, you'll notice those are the same settings. And then hemostasis. So you will see that those are the suggested settings. Once again, those can be altered and changed depending on what's going to be best for that particular patient. But this is a great guideline for you to be able to do what you're doing. So just to show you a little bit about the settings for the Epic X, Lynn Atkinson has helped me by just taking some pictures of the different settings for these particular settings for the Epic X. So if you already have that one and you're not getting your Epic Hygiene at this point or working towards it, these would be the settings that you could utilize for those same procedures with your Epic X. Now, pocket therapy. That is what we're going to do by administering a very low power of laser energy into the sulcus throughout the entire dentition of the mouth. So I try to look at that as almost a pre-procedural rinse. We're trying to put that laser energy in there so that we can spread that energy through the mouth to be able to get that pocket therapy to take place. That can be done on a prophy appointment. That can be done at the beginning or the end of a perio appointment, depending on how you want to use your pocket therapy. And as we look back on the slides that we just were talking about, those would be the suggested settings that you could start with. Why would we provide pocket therapy? so where the debris can be reduced in the sulcular area, to generally be performed at the beginning of any dental hygiene appointment to prevent cross-contamination, as I mentioned, as a pre-procedural rinse, and to reduce inflammation risk. So those would be the main 3 reasons for pocket therapy. Here is kind of how it's being looked at. What settings, again, you would use. You would use a very low energy, an uninitiated tip. We're just putting that energy in there. This is going to lower the micro count in the aerosols that are usually being put into the air. This will also stimulate new cell growth and healing of the tissue. You only have to put this laser in about 0.5 millimeter to 1 millimeter into the sulcus. At the pulse mode, it gives you suggested settings so that you can be using those. And at the same point, you can peak that up a little bit higher if you choose to use continuous mode or the pulse mode. That laser energy is going to be in defocus mode, and you're going to only spend about 10 to 15 seconds per tooth. So taking only 5 to 10 minutes for the entire mouth. So it's more of a sweeping motion just to be able to get that laser energy into the sulcus. Periodebridement, which is otherwise known as laser-assisted periodontal therapy, or LAPT, is a category that we can also use with our Epic Hygiene laser. Why would we do these periodebridements? We are going to create sulcular debridement with epithelial and granulation tissue removal. We are going to use in conjunction with scaling or replaning, or as I prefer to call it, periodontal therapy. We also can promote growth factors for healing, and the ultimate goal is tissue rehabilitation. If we can get some of those pocket depths to be minimized because it gives those areas a healthy interaction to be able to get new tissue growth to take place, it allows us to help close that pocket off and be maintained by the patient at home, along with our help of periodontal cleaning appointments scheduled at the appropriate time for each patient. This is a video also by Lynn Atkinson of how the laser-assisted periodontal therapy will work. So I'm going to see if we can get this to play for us. So you can see how there she was getting some coagulum to come off onto the tip of that laser. When that happens, you want to make sure that you stop at a very timely amount of time. When you see that connecting onto the tip of that tip, you're going to want to stop, take your foot off the foot pedal, take a 2x2 that's either dry or wet with water, never using alcohol-soaked gauze, and wipe off that tip so you can get that coagulum off the tip of it. Otherwise, that's going to continue to collect and can help that to be a little bit more hot on that tissue. You also noticed how she was kind of backing in between the teeth. So instead of pointing it to the tooth, make sure that you're always pointing towards the tissue. That's where our interaction takes place, not on the tooth structure, as we showed you on the slide earlier, but actually with the tissue. So we want to back into this in between the teeth so that we can make sure the tip is actually pointed towards the tissue as you work around the mouth. Now, for some situations, that might have been moving a little too fast, and in other situations, that could be too slow. So you do have to just read the tissue. There is not a thermostat on our laser that tells us what temperature we're approaching, so you actually have to be able to see what's taking place with the tissue. Remember, as hygienists, that our scope of practice is something we need to take into consideration, and that cutting tissue is not in our scope of practice. So we can only be able to reduce bacteria, eliminate bacteria, maybe we're debriding, any of those choice of words other than removal, because that is outside of our scope of practice. Oh, here is another couple of slides for you. So you can see this thin handled tip of what we have on our Epic H is something that fits very slim in our hand. It's not too bulky. We want a laser that we can actually get to the distal of a second molar so that we're not trying to not treat those areas because we can't get to them, or for the patient who can't open their mouth real wide. So the tip is always going to be pointed towards the tissue and always going to have that slim handle that we can work with, which makes it so much easier to work with. Also on this laser, do you notice that the white cannula is not having a red glow coming from it? That's one of the things that happens a lot with Biolase tips, is that people are not tightening them incorrectly. You want to make sure that when you think that laser tip is tightened in that handle as far as it can go, that when you put it in ready mode, if you see a red glow still around that white plastic, it means that you still don't have that tip in as far as it can go. So for ultimate benefit, you need to tighten that even tighter. Maybe taking a 2x2 gauze, wrapping it around the edge of that tip, and then being able to tighten it in even further. Very important tip. Otherwise, you're losing energy out the side of that laser cannula. So always follow through with that. So this one just shows the left side showing the perio probe in place. Then we have the middle slide, which shows how the laser would be placed. And then the far right one is post-operative. So immediate right afterwards, you might have a little bit of redness around some of the tissues. And what we always suggest is using something like vitamin E, or maybe a perio-science product that will allow us to use that along the gum tissue to be able to oxidize some of that, or that coagulum off of those tissues, so that we can actually get those areas to look healthy and nice, especially when the patient's going to leave and you don't want them to think that their gums have been cut or that they're bleeding, and be able to let those areas heal. That's allowing that healing process to begin and our tissue attachments to start taking place. So other laser procedures for hygienists, one is to do aphthous ulcers or herpetic lesions. This is in a non-contact mode, meaning we will not be touching the tissue. It's a non-initiated tip. We don't want the darkness on the tip because we want that energy to be able to come from the tip to kind of spread over that herpetic lesion. Now, stepping back a step, some hygienists will use an initiated tip for any type of pocket debridement, and others will choose not to use initiated tip. So there are no right or wrong between those. It's just kind of a personal preference of how you've been trained to make sure that you understand what's taking place in the difference of those and how you correct it if you are stepping over the boundaries of what we can do in hygiene. And then back to the aphthous ulcers and herpetic lesion, non-contact mode, non-initiated tip, and in continuous wave. High volume evacuation is always mandatory for any time that you use a laser. So a saliva ejector is just not going to get enough of the plume of smoke that could portray from a laser. For instance, when you're a new laser user, a lot of times your foot doesn't always come off the pedal as you're exiting the sulcus, and that plume of smoke can be very toxic. So it's very important to wear a class 3, level 3 mask and have it be a 0.1 micron mask so that you have the biggest benefits of not inhaling those plumes of smoke. It's a high volume evacuation. You could also use Isolite or a product similar to that, or even have the patient hold the suction just on their chin where they're collecting that plume in that suction tip. With aphthous ulcers or herpetic lesions, you can start at the settings that Biolase has on our handbook of just a certain setting and just spiral around that area until you feel that it's covered. We prefer to call that almost as a cross-hatching motion, where we're going over the top of it in one direction and then going back over it in another direction to be able to cover that area completely. Another setting would be the setting that you're seeing on this slide, starting at 0.3 watts of power and going over that section in a cross-hatching motion. Now we say every 45 to 60 seconds, but it's really going to depend on the size of that herpetic lesion. If that area is a very small area, you probably won't spend 45 to 60 seconds on it because you would be spreading a lot of energy, a lot of laser energy over a small area, and could cause those areas to be a little bit more uncomfortable with the heat. On the other hand, if the area is a little bit larger and that surface area needs to be covered, it's going to take you a little bit longer time. So that 45 to 60 seconds is strictly just a guideline to let you know that it could be more and it could be less. So I start about 2 millimeters away from the lesion. I set my laser at 0.3 watts of power. And then at that point, I'm going to circle around the area. And then I go in one direction until I fill in that circle. And then I crosshatch it at a 90-degree perpendicular motion and go back over that area. And so until I completely cover that area. I start at 0.3. Then I go by bumping it up 0.2 milliwatts to where I then would be at 0.5 setting. So 0.3 to 0.5. Then I would go from 0.5 to 0.7. After that, I would go from 0.7 to 0.9. And the highest I would go is at 1 watt of power. So those are the settings that I would choose to use over a herpetic lesion. Just want to share a couple of cases with that. This is one from Lynn, who actually you can see on the left side where the herpetic lesion was quite large. And you can see when that energy from our laser fiber is placed over it, how it has that red glow around it. So that is still giving a thermal benefit even before she puts her foot on the foot pedal to activate the laser to get the actual laser energy to come out of the laser. So as that is heating up that area and she starts those specific settings we were talking about, the patient can experience warmth. Usually the lower settings, it's going to be pretty warm. And the higher that you go with those settings, sometimes the patients will feel a little bit more heat. There's two things you can do to eliminate that. One, notice her high volume suction on those areas to pull away the plume. It also helps cool that area. That would be one. You could actually move away a little bit further so that it's not as close to the tissue, because then it's going to cover a larger surface area and reduce the heat. And truly, there's three, you can actually go a little bit faster. So if it's hitting the tissue too long in one area and producing a lot of heat, you can move it a little bit faster to get rid of that sensation for the patient. So listen to your patient. If they're comfortable and you can keep giving that little bit of laser energy into those areas, you're going to give the benefit that it's going to help keep those areas healthy for them. So typically, the best time to reach a herpetic lesion is the very first few days that it arises. Now, with that being said, that doesn't always happen if it shows up at Friday night at midnight and we're not back in our clinical office until Monday morning. So treating it a few days in, you may not get the same benefits, but at least you can alleviate the patient from discomfort. And that's how you read it, is if your patient is comfortable, you know that you've reached those areas to where you are getting that laser energy in there and giving that benefit of what the laser can do to the patient. This was a case study that I did back in 2004, where a girl fell asleep on the beach in Cancun. In figure 1, you can see where her lip is very swollen. She had very full lips to begin with, as you can see in figure 4, which was our final after a couple months after the episode. But you can see in slide 1 that her lip was very puffy, and actually she was kind of slurping her saliva because her lip was so puffy. So instead of treating that whole lower lip all at one time, I kind of broke it down into 3 little sections. So I did one section at 0.3 watts of power and did my little cross hatching marks over the edge or over the surface of it. Then I went to the next area and I did that over 3 areas on her lower lip. Then I went to the 0.5 settings and did the very same thing all through the settings that I just shared with you. If you can see the date on that, March 22nd of 2004 was slide number 1. The very next day I brought her in just to see how she was doing. You can see that the lesions have reduced tremendously, but the very best part is that she told us that she could no longer feel the discomfort of the tingly sensation that she had and the pain where that tissue felt really tight stretched across her lip. So in 24 hours, just pain alone was reduced tremendously. Slide number 3 shows us a few days later where everything was starting to heal up. And then slide number 4 was the final result a couple months later. So you can see no scarring, no issues, no concerns. She was probably one of our biggest spokespersons when it comes to lasers because she particularly just loved to come in and have us laser. So she would drive between college classes and call and tell us, hey, I think I'm getting a herpetic lesion. Can I please come in? So I've always said that these are our practice builders. If you build it, they will come. For instance, you can market that. You can make sure that people know you have a laser, and you can do it at the beginning of appointment if a patient comes in, and then still continue on with your appointment if you choose to do so, or just treat the herpetic lesion or aphthous ulcer and send them on their way or reschedule them for the rest of the work that you needed to have done. Here's another case that I did. This lady had her lips cosmetically tattooed with a red color, and she had allergic reaction to it. The only way I can really explain this is that if you take rock salt and peppercorn and spread it on her lips, that's what it looked like when I saw it. The smell was horrific, and the white that you see in slide number 1 was infection. She had asked me at that point, now this is back in 2006, can your laser do this? Can it work to be able to get this under control? And to be honest, the laser was new enough to, practices with herpetic lesions that we didn't really know what it was going to do, but I did know that it was going to be safe for us to use on her and not cause any discomfort or not cause any type of permanent scarring. So we treated the laser on these areas. Now on this one, I did it in 6 categories. So I went ahead and divided her lip into 6 little sections and treated with the laser on the very same settings that I shared with you earlier. 24 hours later, she came back and you can see the difference. You can see that one, the white was gone. It is a little bit shinier because I put vitamin E on there before I took the photo. So you can see that it was a little shinier. But the best part is you can start to see the lip color underneath that. So it was starting to shrink up and heal up. One of the things that's really important is to tell your patients never to pick off those scabs. Just let them heal up. And also that once you start using the laser, using any other product on the market, sometimes we'll dry those out and be kind of a disservice to us where we want to keep those areas more moist, keep those from splitting and causing that virus to spread. In slide number 3, there again, a few days after that, you can see where those areas just continue to heal. And then in 3 weeks later, you can see where we didn't have any scarring. Now at that point, she wasn't really happy with the results of the cosmetic tattooing and chose to go back and have them retouch up those areas again. I tried to make her look at slide number 1 again and remember what they looked like prior to that, but she went back not once but twice to have them do a touch-up. The good thing is that right afterwards, I just brought her in and lasered those areas. Even though cosmetically I didn't see anything, I went ahead and just put laser energy over the top. And the good thing is we never had a further outbreak in the time of the treatment. In 2012, this is what her lips look like. So you can see that the results turned out really good, no scarring, everything looked great from the treatment that we did with our laser as well. So one thing that's very important is laser safety. I cannot stress this enough. If you do not learn anything from me tonight, please always learn to wear your safety glasses. This is of utmost importance. Class 4 lasers, such as the lasers we've been talking about this evening, are very high-powered lasers. They can create a hazard to eyes, to skin, and they can catch things on fire if you are to touch them onto something that is flammable. For instance, 2x2 gauze. Maybe the patient's bib. We should never lay the laser on the patient and accidentally hit the foot pedal. Articulating paper, if we're using that to initiate the fiber, make sure that we're initiating at a very low setting and then turning the laser up so that we don't take the chance of starting articulating paper on fire. We already discussed that it does generate air contaminants, meaning that we do need to have some type of suction on there so that we can protect those areas and keep that plume eliminated for us as well as our patients. An LSO is always required. That's a laser safety officer. Their job is to make sure that the lasers are in good working order. Now this could be the hygienist in that operatory, or it could mean that it could be somebody else in the office whose job is to make sure the lasers are working, you have the correct laser for the procedure you're trying to do, making sure that there's plenty of tips, the correct tips that you need. Remember with Biolase, we have 4mm tips, 7mm tips, and 9mm tips. So depending on which procedure you're doing will determine which laser tip you choose for that application. We also have maximum permissible exposure for the value of the eye and the skin to make sure that there again, we're not causing any hazards. The nominal ocular hazard distance, meaning how far from the patient's mouth do we have to be and not wear safety glasses. So when we're in that zone, we have to have those safety glasses on, and that's going to vary from laser to laser. So you're always going to want to refer to your operator manual, your owner's manual, to make sure that you have that information correct. The nominal hazard zone is the room. Maybe you don't want some big mirrors sitting right next to where you're going to be working on the patient with the laser. Remember, they can be very reflective and they hit that laser beam and it can shoot that laser in a direction outside of that zone and be damaging. So always make sure you know what your surrounding is and make sure that that is protected. Also, if you're going to use nitrous oxide, any combustible gases, you should make sure that you have the proper scavenger and suction techniques. We discussed earlier staying away from any alcohol-based moistened gauze or any topical anesthetics. And that if your patient is on oxygen and they can go without their oxygen for a few minutes for you to use the laser, that you should wheel their tank away from the patient so that you can make sure that you're using lasers in a safe manner. We have to make sure that we have the safety glasses and make sure that they are actually the correct glasses for the correct laser. Don't just take someone's word for it. You need to make sure you understand how to read your glasses. On the back of our laser is a little box that indicates which class 4 laser it is and tells you which wavelength it works at. These glasses, for instance, would work great for us to use on our 940 Epic X. You can see on the far left of the screen, the second column down, that this laser works for, or these glasses work for an 840 nanometer to a 950. So our 940 Epic X laser fits into that category. And if you follow that line over, you can see where it says the 950 to the 1070, and that's where our Epic Hygiene falls into at 980. So that's how you would read those to make sure that you have the correct glasses for the correct laser. So don't ever just take someone's word for it. Make sure that you understand how to read those on your own. We talked briefly about high volume evacuation. Not only does it help cool the site, so if you have heat being produced with a laser, then it helps put a cooling effect over those areas. And it also can be used to remove the plume. So when that plume has been removed, that way the patient is a lot more comfortable on those areas as well, and you don't have to breathe any of those toxins. Documentation is always very, very important. You will see there's a few things here that we need to make sure is documented. The most important thing is going to be what setting did you set it at? What that time of exposure is. So if you had it set at 0.5 watts of power and used it for 10 minutes, that needs to be documented into your chart. But most importantly, I also want you to make sure that you have safety glasses worn by everyone in those areas. So anybody that's in that zone has to have those safety glasses on, and make sure that is documented in your chart so that you don't have any issues of somebody coming back and saying they had an eye injury. You have documentation. Remember, if you don't have it in your notes, it doesn't exist. So we also have a few key phrases and verbiage that we need to take into consideration. So here's a list of them. I'm not going to read them all, but most of these will help you explain things to your patients. One of the terms that I really want you to get away from is saying a little bit. If you say that somebody has a little bit of infection, they don't have nearly the value on it as if you just tell them that they have infection. Same thing with bleeding. A little bit of bleeding makes it seem pretty insignificant to where they don't think there's a big concern. So talk about the words infection, bleeding. We want these to have healing. It's a significant disease. Make sure that you stress what's taking place. They're living in a disease state. This is a permanent bone loss. This is something that we need to maintain your periodontal health. And figure out what that sequence of therapy is so that you can explain to them where you're going to start, what those benefits are going to do, what you're going to do when you retreat those areas, and what you're looking for. And also let them know what you think their optimal results will be. If we do this, Mrs. Jones, this is what my anticipation will be for you to have these great results. However, it is something we have to maintain, and that's why we need to have you come in at the suggested amount of time and recall that we're looking at, because the laser treatment helps the body heal itself. Remember, the mouth is attached to the rest of the body, so we have to treat the mouth so that we can therefore make the rest of the body healthy as well. So everybody always wants to know, okay, how are we going to get paid for this? What we're looking at, some of the charges. Now, this is going to depend on where you live. Sometimes charges are going to be different. And most importantly, what we are looking at when it comes to insurances. If you are with insurance policies, sometimes you have to follow their rules and make adjustments or write-offs. But these are suggested charges as far as what we're looking at for return on investment. So for pocket therapy, about $50 per mouth. There again, yours might be higher, yours might be lower. For perio debridement, $100 per quadrant or per session, depending on how much of the mouth you're able to achieve results in for each particular appointment. So if you did 5 days of hygiene per week and equaling 8 patients per day, the first thing, 50% of your patients, if you just treated them, look at what your over 12 month you could create as a revenue of $72,000 a year. If 80% of your patients were treated, look at what you could generate just by having your laser. How can you not have a laser when you see these types of numbers? So there again, these are suggestions, but at the same point, it does create a return on investment. People are very high tech, and when they start understanding what lasers can do, they want them to be used on them. So this gives you a wide range of variety of things that you can do and look for in the hands of a hygienist. Here's a couple others. Maybe we are increasing the period debridement to 150 per quadrant or per session. Same place things come into place. 50% of your patients are treated, and then 80% of your patients are treated. Look at the difference in numbers. And if I throw one more in there, always, always, always understand the scope of your practice. Each state is different. Some states have something on there that says, no, a hygienist cannot touch a laser. You can't even look at a laser. Other states have very rule specific that says in their state, you have to have certification or training, depending on how they word it. And they will also tell you how many hours and possibly where you have to go to get that particular training or certification. Many states fall into non-regulated. It doesn't say that, yes, you can use it, but more important, it doesn't say you can't use the laser. So with that being said, read your scope of practice, interpret what your state practice act is, and follow those guidelines for you as a clinical dental hygienist. So this is some information on me. If you have other questions that we're not able to get to tonight, you are more than welcome to contact me by email, or you can text me or call me, and I will be more than happy to help you in any way, shape, or form that I can, because helping hygienists be wonderful laser hygienists is something that I absolutely love to do.